In the name of Allah, the most gracious, the most merciful. As Muslims, we are taught to take care of our health as a trust from Allah. The Prophet Muhammad, peace be upon him, said, "There is no disease that Allah has created, except that He also has created its treatment." Sahih al-Bukhari. This hadith reminds us of the importance of understanding both the benefits and potential risks of what we consume. Eggs, a staple in many diets and considered a nutritious food in Islamic dietary traditions, can sometimes pose unexpected risks when combined with certain medications. This article explores the surprising interactions between eggs and various medicines, based on recent scientific research. As we delve into this topic, let us remember the Quranic verse, "And we send down of the Quran that which is healing and mercy for the believers," 1782, reminding us to seek knowledge that can protect our health. Antibiotics and eggs, an unexpected conflict. Some antibiotics, particularly tetracyclines and quinolones, can interact with the calcium in eggs, reducing their effectiveness. A study published in the Journal of Antimicrobial Chemotherapy in 2022 found that consuming eggs within 2 hours of taking certain antibiotics reduced the drug absorption by up to 50%. Key medications to watch include tetracycline, doxycycline, ciprofloxacin, and levofloxacin. While eggs are not specifically mentioned in the Quran, they are considered halal and nutritious. However, the principle of avoiding harm, la darar wa la dirar, in Islamic jurisprudence supports being cautious with food-drug interactions. Even a single egg consumed close to antibiotic intake can significantly reduce the drug's effectiveness, potentially prolonging illness. Blood thinners and eggs. A delicate balance. Eggs are rich in vitamin K, which can interfere with the action of blood-thinning medications like warfarin. A study in the Journal of Thrombosis and Hemostasis in 2023 showed that patients on warfarin who increased their egg consumption experienced reduced anticoagulant effects, potentially increasing their risk of blood clots. Key medications to consider are warfarin, Coumadin, and other vitamin K antagonists. The Prophet Muhammad, peace be upon him, encouraged moderation in all things. This principle applies to egg consumption, especially for those on blood thinners. Consuming just one extra-large egg daily can alter the effectiveness of blood thinners enough to require dosage adjustments. Cholesterol-lowering drugs and eggs, a counterproductive combination. Statins, commonly prescribed for lowering cholesterol, may have reduced efficacy when consumed with high cholesterol foods like eggs. A study published in the American Journal of Clinical Nutrition in 2024 found that individuals taking statins who consumed more than one egg per day had smaller reductions in LDL cholesterol compared to those who limited egg intake. Key medications affected include atorvastatin, simvastatin, rosuvastatin, and other statin drugs. The Quran encourages us to eat from the good things Allah has provided. 172. However, it also emphasizes not throwing ourselves into destruction. 195, which can be applied to avoiding harmful food-drug interactions. The cholesterol in one large egg can reduce the effectiveness of some statins by up to 15%, potentially negating part of the medication's benefit. Thyroid medications and eggs, an unexpected interference. The iron content in egg yolks can interfere with the absorption of thyroid medications like levothyroxine. A study in the Journal of Clinical Endocrinology and Metabolism in 2023 demonstrated that consuming eggs within 4 hours of taking levothyroxine reduced the drug's absorption by up to 40%. Key medications to be aware of include levothyroxine, synthroid, and other thyroid hormone replacements. The Prophet Muhammad, peace be upon him, said, "The stomach is the house of disease, and abstinence is the head of every remedy." Sahih al-Bukhari. This hadith emphasizes the importance of being mindful of what we consume and when. Even the iron content in a single egg yolk can significantly impact thyroid medication effectiveness if consumed too close to the medication time. Osteoporosis medications and eggs, a calcium conundrum. Bisphosphonates, used to treat osteoporosis, can bind with calcium in eggs, reducing their absorption and effectiveness. A study in the Journal of Bone and Mineral Research in 2024 found that patients who consumed calcium-rich foods like eggs within 30 minutes of taking bisphosphonates had significantly reduced drug absorption. Key medications affected include alendronate, risdronate, ibandronate, and other bisphosphonates. The Quran encourages us to protect our health and strength. 860. Being aware of food-drug interactions aligns with this principle of safeguarding our well-being. The calcium in just half an egg can reduce bisphosphonate absorption by up to 60% if consumed too close to medication time. Antidepressants and eggs, an unexpected mood alteration. Eggs contain tryptophan, an amino acid that can interact with certain antidepressants, potentially altering their effectiveness. A study published in the Journal of Clinical Psychiatry in 2023 suggested that high tryptophan intake from foods like eggs could interfere with the action of some selective serotonin reuptake inhibitors, or SSRIs. Key medications to consider include fluoxetine, sertraline, paroxetine, and other SSRIs. The Prophet Muhammad, peace be upon him, emphasized the importance of mental well-being. Being mindful of food-drug interactions that could affect mood aligns with Islamic principles of maintaining holistic health. Consuming multiple eggs daily while on certain antidepressants may lead to unexpected mood fluctuations or reduced medication effectiveness in some individuals. As we reflect on these unexpected interactions between eggs and various medications, we are reminded of the Quranic verse, "And do not throw yourselves into destruction." 2:195. This divine wisdom emphasizes the importance of being cautious and informed about what we consume, especially when it comes to potential food-drug interactions. The scientific research behind these interactions reveals the complex relationship between our diet and the medications we take. It highlights the need for Muslims to be vigilant and informed about their health choices, aligning with the Islamic principle of preserving life and health. Key takeaways. Firstly, if you are on any of the mentioned medications, consult with your healthcare provider about safe egg consumption. Secondly, consider timing your egg intake to avoid interference with medication absorption. Thirdly, be mindful of the quantity of eggs consumed, especially if you are on blood thinners or cholesterol-lowering medications. Fourthly, remember that moderation is key, as emphasized in Islamic teachings. Lastly, educate your family and community about these potential interactions as a form of sadaqah, or charity. It's important to note that while these interactions are based on scientific research, individual responses may vary. Always consult with healthcare providers before making significant changes to your diet or medication regimen.
Thank you for joining us today. Until next time, stay healthy and blessed. Wa alaikum assalam.